The Health Secretary admitted today there are real pressures on staffing at London's hospitals. Jeremy Hunt was announcing a cap on the amount NHS trusts can pay to agency staff. One in East London spends £81 million a year on temporary doctors and nurses, with critics saying poor planning means it'll be difficult to bring those costs down. Here's our political correspondent, Simon Harris.
It's one of London's biggest and best equipped hospitals, a shiny beacon of a 21st century health service. But the Royal London is part of a hospital trust hemorrhaging £7.5 million a month on agency staff. According to one health union, it's the fallout from a decision to axe 220 nurses' jobs.
These were your experienced senior nurses who were delivering and leading the organisation. So what that did was that wiped out a huge amount of nursing knowledge, ability and skills, which actually then left Barts in real difficulties because they then didn't have the leadership they need to attract new recruits.
The Royal London is part of the Barts NHS Trust, which spent £81 million on agency staff last year. Another trust, King's College Hospital Foundation, faced a bill for £80 million. The Royal Free Hospital Trust spent £67 million. Mark Boothroyd is a staff nurse at St Thomas's. He works alongside agency colleagues and can understand why some NHS nurses jump ship.
Agency wages are 2 to 3, sometimes 4 times what you get in the NHS. Some nurses will do their NHS job and then work agency in their free time to make up the shortfall. Others just go fully for the agency salary because it's much better pay for doing the same work.
Today, the government came up with a plan to tackle the staffing crisis in London's hospitals. It's imposing a cap on the amount they can spend hiring in nurses and doctors to cover vacancies and fill holes in the roster.
Yes, I do accept there are real pressures in London that you don't face in the rest of the country because of the cost of living in London being much higher and also the competition for staff being much higher. And we're doing everything we can to work with London hospitals to help them deal with their very particular challenges.
The unions argue there's a better cure: improved pay and conditions for the staff, and there will be fewer vacancies and less need to hire in from outside.
But Simon, will this cap on agency fees actually make any difference?
Well, the theory is that if hospitals only have so much to spend on agency staff, if the agencies charge too much, they won't get the business, so they'll have to lower their rates. The health unions say it's an interesting idea, but they're not so sure. What happens if you're a hospital manager and you desperately need to hire in nurses and doctors to care for patients? Do you have to get into some sort of standoff with the agencies to see who blinks first? But the unions and the government do agree on one thing. The problem in London is far more acute than anywhere else in the country because there are twice as many vacancies in the NHS here, largely down to the cost of living. And of course, that means that if money is being spent on expensive agency care, that's less money for medicines.